Hi, everyone. This is it. We're 5 minutes behind, and I'm not stressed about it at all. Okay, so we've moved from the cells, well, we've moved from the DNA to the RNA to the proteins to the bacteria, and now even more to the brain. So we have the pleasure of hearing Dr. Jay Wellons this afternoon, a neurosurgeon from Vanderbilt, who will tell us and do a beginning of a talk, and then he's going to sit down and read to us. So welcome to the afternoon session, and buckle up.
All right, great. Thank you, Dr. Swanson, and thank you to Professor Gold and Professor Hunter for asking me to come to this amazing thing. I have really enjoyed the day so much, and I'm very grateful. I'll tell you a little bit myself first. So my name is Jay Wellons. I am a pediatric neurosurgeon, currently at Vanderbilt University Medical Center at the Children's Hospital there. Before then, I was on faculty at UAB for 10 years. Before that, I did my residency at Duke. And then before that, I was barefoot running around Mississippi somewhere. But I have operated on probably between 7,500 and 8,000 children with neurosurgical issues over the last 25 years. I've taken care of countless more, around 578 brain tumors that I've taken out from children and counting. We do work on vascular lesions of the brain. We do work on children that have hydrocephalus. And I'm also have always been an academic neurosurgeon. And what that means is that residents and fellows and teaching and medical students and whoever unlucky person happens to wander by my clinic gets taught something at some point by me. Sometimes it's how to do things, and sometimes it's how not to do things. But the point is that being in academics and education is a tremendous part of what I do. In addition, I've had a research career that I'm very grateful for. And, you know, as John Cleese said, you know, and now for something completely different, it's going to be less about the wet lab and a lot more about clinical outcomes research. And that's the world that I lived in. I helped to set up a couple of significant research groups at Vanderbilt. And then I also have had an opportunity to do a lot of publishing in that area and be on our journals and so on and so forth. I have to just do disclosures and make sure I got all the buttons right. All of these are grants and so forth. Makes me a little bit sad. I get a little bit verklempt seeing the old NIH grant now with all the changes that are happening. Forgive me if I break down and cry. But I think the most important one is probably the fact, since I'm here talking about writing and advocacy, is this one that I need to disclose. But I won't be, you know, trying to sell anything. Don't worry. Thank you. This is what I really wanted to pivot to. And I think everybody has seen this. It was a correspondence that came through from the University of Michigan. But this has been on the top of our minds for the last 2 years. And the specific issue is this. So this really is, to be honest, is the beginning of my career. I finished my residency at Duke right at 2000, did a fellowship in 2001. And then this has been the time that I've been in practice. This is the initial thing that you see. So back when I began practice, there was a substantial 10 per 100,000 died children. And now that has come down substantially. I could be a little bit, you know, kind of not so happy to see that there's not a substantial change in malignant neoplasm a little bit. But this is the one that gets me, the firearm-related injury. Now, this is important to know that this is children and adolescents, and they count adolescents up to the age of 20. But it doesn't matter, because that number has gone up, and it's gone up substantially. Now, as a neurosurgeon, you would think, is this really the only thing that, that he has to sort through? Because this is really sad. Brain tumors are really sad. And it turns out that there's a lot of things that we do. So I'll just give you a rundown of my team real quick. This is our division of pediatric neurosurgery. We're underneath the Department of Neurosurgery, which I'm vice chair for. And we're underneath a section of surgical sciences at Vanderbilt. But this is my partner, Rob Naftel. He does epilepsy surgery and surgery for kids that have spasticity or have a hard time walking. And those surgeries can be life-changing. And the joy that comes from that is substantial for those families and for those children. Chris Bonfield is our craniofacial surgeon. He helps fix kids' skulls. and also does scoliosis and spine surgery. For those of you in medicine, we call him our epidural neurosurgeon because he doesn't actually go underneath the dura, but that's a crummy neurosurgical joke, I'm sorry. Thank you for laughing, Dr. Swanson. Michael Dewan was a terrific resident, and when he came back from his fellowship at University of Toronto, I handed over the brain tumor and vascular malformation practice to him, and he's just terrific. Haley Vance is the best nurse practitioner in the country, and Charles Markham is an awesome person who works in our clinic. And I'm very proud of the 6 of these because without, well, the 5 of these, I'm not proud of myself, I suppose. That's kind of odd, but I am very proud of them because without them, we wouldn't be able to do what we do. We wouldn't be able to take care of kids. Kids with hydrocephalus, kids with brain tumors, kids with things that are hard, and kids with things that we can fix. We're a very tight-knit group, and there's only 254 pediatric neurosurgeons around North America, and that's a tight-knit group too, because sometimes people are grateful for what you've done, and you get a beautiful little drawing of yourself and the child with a rainbow arcing over the top. And sometimes you have parents that never ever want to see you again. And so with that, that's kind of the career of being a pediatric neurosurgeon. So what I wanted to do is talk a little bit about something that has happened to me as my career has pivoted. In addition to doing all the things that I talked about before, I also had the opportunity to write a book. And that opportunity was transformational for me. The ability to kind of lean really heavy into the right brain, for example, and really draw back on my English degree from the University of Mississippi, the Department of English. The chance to go out and talk to families, to talk to people about families and about patients has been a remarkable one for me. And also what's happened over that time is that I've had the opportunity to pivot into advocacy. And you can imagine seeing children that have injuries from gunshot wounds, being in the emergency room when the Covenant School shooting happened in Nashville, seeing this graph that I showed you before of the number of children who are killed in the United States of America is something that has really transformed me. In Tennessee, 1 out of 5 pediatric deaths are from firearm injury. We are number 3 in the country for accidental shootings. And ever since the law that was passed that said it was okay to have concealed carry, we'd have an 11% increase in pediatric deaths alone. So there's a lot of work to be done. So I have kind of taken this dive a little bit into advocacy. And in talking to Dr. Swanson last night, I know this is a huge part of your career. So please just indulge me to talk a little bit about what it's been like moving through this path, if that's okay. So I really want to start off just by giving some examples of people that have really had a big impact on me. And on the right is a woman, a friend of mine named Hillary Glenn. Oh, and I also wanted to tell the 2 professors here is that I decided that I would write something for you all. And so I wanted to sit down and read it, if that's okay, as opposed to walking around like, okay. So I want to tell you about a friend of mine. Her name is Hillary Glenn. Hillary's a nurse practitioner who I first met 2 years ago at a yoga class down on the 30A Beach region on the coast of the Florida Panhandle. The instructor made sure to introduce us as the book that I'd written had just been published, which she miraculously had read. And she thought that Hillary and I had a good bit in common. What I quickly learned was that Hillary ran a free clinic nearby designed to care for all the men, women, and their kids who came in to work on the houses and the buildings and the roads, all the infrastructure that we took for granted as we vacationed. Those folks, often Hispanic but not always, traveled up to 2 hours by bus every morning and every night just to be able to work and care for their family. So basically, the workers made just enough for food and a roof over their heads, but not enough money for extras like health insurance. So that's where Hillary came in. Hillary obtained her nurse practitioner degree at Columbia University in New York City, and then went to work for 10 years at Bellevue Hospital, the oldest public hospital in the country, where her eyes were opened to the disparities inherent in our healthcare system. She moved with her family to the Panhandle area of Florida and obtained her doctorate while working at an urgent healthcare center. She quickly saw the disparity between those enjoying the homes and the restaurants at the beach and those who wielded the hammers and the nail guns and the dishwashers that kept them going. She had this idea that somebody ought to be taking care of these folks, and why not her? So she first started working part-time out of a church parish hall, 2 days a week. Soon she recruited a physician to help, and as word got out, the patients began to come in droves. Also, as word got out, the members of that community began to step up. Soon, supplies and medications and all the things one would need to set up a real clinic were overflowing. To Hillary, it felt miraculous. As the clinic became busier and busier, the idea just came to her in a snap one day. They needed a dedicated space to be able to see these patients every day of the week. Over the next 5 years, Hillary and her co-advocates met with community leaders and donors and garnered donations of cash, supplies, and labor. After they broke ground for a new clinic, landscapers and artists in the community began to show up too. Just 15 months ago, Point Washington Medical Clinic opened its doors, and the space is nothing short of beautiful. There's 6 exam rooms, 4 dental chairs with TV monitors hanging down from the ceilings, office for the volunteers, a wide open reception area with interpreters and computers available, and a play space for children. The local bookstore in Seaside, Sundog Books, donates children's books each month. Those artists I mentioned, they decorated the walls with murals recreating local habitats of the wildlife in the area. In the pediatric rooms are murals covered with animals and at the height of a kid. The Point Washington Medical Clinic was recently awarded a gold standard by the National Association of Free and Charitable Clinics, and they have a new special position just to handle the volunteer healthcare worker schedule and the donations. In the past several years, the volunteers at Point Washington have provided over $4 million in care. And at the same time, they've saved over $6 million in unnecessary emergency department visits. All from one woman's vision, a vision that came from simply looking at the needs of her new community when she arrived years ago and concocting a plan for what needed to be done. Hillary and her colleagues' work is an example of boots-on-the-ground public health and is a definition of advocacy better than any dictionary can provide. If you're ever headed down to the 38 region and the Florida Panhandle, let me know, and I can put you in touch with Hillary. But let me warn you, she'll definitely put you to work. Now, I was born in Columbia, Mississippi, so I grew up in the South, much closer to New Orleans. We were about 90 minutes due north of there, just over the Louisiana-Mississippi north-south state line. It turns out that New Orleans and Memphis are the largest cities in Mississippi. That's another Southern joke for you know. Either way, you have to turn off of a main highway no matter which way you come from. You have to take a country for weird, serpiginous turns, a few gravel road cut-throughs. Then, like Brigadoon itself, the small town of Columbia, Mississippi appears through the mist of the Pearl River, or possibly the clouds of mosquitoes. 12,000 humans in the county now, and when I grew up, we had the highest unwed birth rate in the entire United States, and a whole lot of poverty. I rode my trusty Schwinn bicycle all over that town. It was my first drop handlebar bike and had 12 gears. I was very proud of it. However, there were streets I was told never to bicycle down, but I could see them down them when I looked. I would imagine some of you here may know what I'm talking about. Such poverty, and in the South divided along racial lines. My family lived on the main street right across from the Marion County Family Clinic, which made it super easy to see the doctor, get allergy shots, bandage cut knees, all the things. Right next to us was the power company, and every time a tornado rolled through the area and the whole town lost power, the family clinic and our home and the power company would be the first to get it back because we were the only ones on the same transformer as the power company itself. Now, across the street, several doors down, was the Marion County Department of Public Health, a place for those with Medicaid or no medical insurance to go. The difference could not have been more evident. The family clinic had neatly cut grass and well-trimmed bushes right out in front. The large windows and sanded pine girders were actually a quite attractive version of late 1960s architecture. The Department of Public Health, by contrast, was a cinder block building. Overgrown patchy grass and out-of-control weeds surrounded the entrance and sides. the look of people going into and out of one building were quite different from those going in and out of the other one. That was my first experience with health disparity, and it took me 45 years in the writing of this piece for me to truly realize that. So my goal is to talk to you about how public health and advocating for public health issues may seem like a fading issue right now, but they're not. Despite the recent unfunding of much of the work of the CDC, the FDA, and the NIH, just to name a few, okay, the USAID as well, the gutting of academic medical centers, public health matters a great deal. As the vehicle for the telling of this, I will also tell how a person from that small town in Mississippi became a doctor, then a surgeon, then a writer, and then an advocate for children's health issues. So forgive me for focusing on myself a little bit. I may end up sounding like Bette Midler in the terrific late 80s movie Beaches. Like, enough about me, let's talk about you. What do you think about me? So, modern public health began in Soho, London, during the cholera outbreak in 1854 that killed over 600 Londoners. Oh, I have to hit the slide. Cholera, if you've not heard of it, and consider yourself lucky if you've not, is a terrible disease in which the majority of water is lost from the body through near constant diarrhea. We talk a lot about diarrhea at the Gold Service thing. It's just one. The organism, Vibrio cholera, releases a toxin that holds open the microscopic channels in the gut designed to regulate water influx into the colon. The mainstay of treatment still involves, get this, cutting a hole in the patient's cot for the watery stool to leave the body. But now, most importantly, either oral or intravenous hydration. The real key is just not to get it in the first place. Dr. John Snow, a local physician in London, made a map of those infected. You can see that on the left, in 1854. What did he notice was nearly exactly at the center of the reported cases? The Broad Street water pump. He astutely figured out that the water must have been contaminated with cholera. You know, there's this idea in the public health realms that John Snow, this physician, has broken off the pump handle itself and he's holding it over his, like I've seen pictures of him holding it over his head in this kind of like congratulatory epic, you know, father of public health. But the reality of it is that after he figured it out, he then had to go convince the municipal government to agree to disable the pump. From that moment in which he had the handle of it, the water pump removed, ending the local cholera outbreak, medicine and public health issues began to gradually merge. As we care for one, we also care for many. Or in the words of the legendary Surgeon General C. Everett Koop, healthcare is vital to all of us some of the time, but public health is vital to all of us all of the time. I was fortunate enough to earn an MSPH in epidemiology while on faculty at UAB due to the influence of a research network I was a part of. I remember vividly the feeling of the first time we all sat down as investigators. This was back in 2005 to analyze the results of a study I had done. I could get stuff done. I could get charts pulled. I could get patients interviewed. I could get data done. But when it came to the analysis of the project itself, it was an analysis looking at the best way to treat infants with premature, with hydrocephalus secondary to intraventricular hemorrhage of prematurity, which is relatively common in our worlds. First time I sat down to listen about how we were going to do the analysis of it, it sounded like the Charlie Brown voice, you know, wah, 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 wah. I understood nothing about the biostats or any part of it. So at that point, I knew that I needed to get trained up. And in the process of doing that, getting that MSPH degree one class at a time, my academic world was really just rocked. I learned about case control studies, statistical imputation, all that goes into understanding how to produce meaningful studies. The example used were so far beyond anything we had done in neurosurgery. I learned about larger studies on treating asthma in children, impact of vaccinations on polio and measles and a host of infectious disease, how the children's oncology group was fundamentally changing the nature of pediatric cancer clinical trials. I remember looking back at my own measly case reports on my CV and being kind of like embarrassed. But it became clear to me that the foundation of pediatric and adult medicine came from a tremendous amount of public health work from generations of pediatric healthcare practitioners who came before us. Since then, when I look at something like the simple curve of the Fenton head circumference charts, I think about what it must have taken to do the work, to put that together, and then to implement it. And what a tremendous impact that has had. The original weight, height, and head circumference curves were based on percentiles taken from 10,000 children. Dr. Fenton who was a doctor but also a nutritionist, noticed that if a child was born premature, often associated with low birth weights, then curves specific for low birth weight and very low birth weight infants were necessary. Those curves have also had a tremendous impact on me. Much of what we see in pediatric neurosurgery is related to head size. Think about hydrocephalus. If you're a child, if you're an infant and your skull hasn't fused yet, then when you get hydrocephalus or CSF inside the brain that's trapped, it squishes the brain, which then squishes the skull and makes the head get bigger and bigger and bigger. That doesn't happen in older kids whose skull is fused. We see it a lot in our world. I mean, honestly, I look at that chart 25 times a day in clinic. I see it in my sleeping and in my waking. But the degree that I got not only had an impact on the research that I was doing, but ultimately led to the foundation of what I'd mentioned to some folks before, the Surgical Outcome Center for Kids, SOCS, which is a clinical research engine for all the pediatric surgical subspecialists at Vanderbilt. Over the last 10 years, SOCS was responsible for 373 academic peer-reviewed publications, 331 national, international presentations, and 52 grants. A few years later, I had the opportunity to design and lead a similar platform for all the surgeons at Vanderbilt, not just the pediatric surgeons, all because of those Charlie Brown voices nearly 20 years ago. But let's go back to Dr. Koop. C. Everett Koop was the U.S. Surgeon General under Ronald Reagan from 1982 to 1989. And I have to say I was just a bit enamored by him in the mid-'80s, like in kind of an Alex P. Keaton kind of way, just to pull back to family ties. He was the first Surgeon General to be a household name. And most of that was due to the compassionate and important work that he did on the AIDS epidemic, what he did for breast cancer. He lived into his role. Smoking dropped by 11% after a long campaign. He championed cancer screening and the rights of children, and he wasn't afraid to wade into challenging social issues. And at the expense of time, I met him one time at Hertz Rental when he was an older man with a walker. I was in Philadelphia. And my friend said, "Hey, Jay's about to take his boards." This is a long time ago, my oral boards. And he goes, "Oh yeah, well, who made the first shunt? Who put the first shunt in?" And I was like, "Well, that was Dr. Nelson and Dr. Spitz at CHOP in 1952. Where do you think that shunt had to go?" I think that was probably into the heart. "Do you think those two neurosurgeons put that shunt into the heart?" "No, Dr. Koop, I do not. I put that into the heart." So every time you give a talk about it, I want you to give me credit. So I'm doing this for Dr. Koop right now. So he actually was part of the first valve shunt. So I don't want to be too long, but I initially entered medical school after a degree in English from the University of Mississippi. With all the wisdom and foresight that a 20-year-old can muster, I decided to go to medical school in order to better understand the human condition. Then over time, I was going to enter family medicine and practice in rural Mississippi, like the docs from the family medicine clinic across the street where I grew up, getting paid in chickens and homegrown tomatoes and finding time to write. Then, it reminds me of the first man who spoke about anatomy. I saw the beauty of the brachial plexus in the gross anatomy lab. The brachial plexus is a series of nerves that come out of the cervical spine, and it reminded me of macrame. They jumble up into a very predictable pattern, and then they unjumble up and go to the rest of the arm. I followed that into the spinal cord and then into the brain, and soon found myself laying down that dream of primary care at the altar of neurosurgery, the all-consuming altar of neurosurgery. In 2017, then 25 years had passed since then, and I was fully immersed in academic medicine. At that time, I was in my second attending job as a full professor of neurosurgery at Vanderbilt. I was busy clinically. I was division chief, residency program director, co-running SOCS, vice chair of the department. Yes, I was Mach 2 with my hair on fire. But it took a substantial event to slow me down, and that event was a tumor in my pelvis. After 2 weeks of wrestling with a substantial existential threat when it was thought to be malignant, it was thankfully found not to be so. But the resection to remove it was significant, and the surrounding muscle that had to be taken out put me on bed rest for 2.5 months while I healed. Over time, it did heal with the help of a device called a wound vac, and don't worry, I'm not about to show you a slide with my scar on it. Don't worry about that. But slowly I began to walk again. Ann Patchett, my neighbor, friend, and author and writing sensei, would come knock on my door every afternoon for a walk around our neighborhood with her chill little dog, Sparky. Soon I could stand for long periods of time to be able to operate again, then exercise and swim. Even though it admittedly occasionally gave me issues from time to time and still does, I'm doing fine, and gratitude is now abundant. But from that forced rest, that time of recollection, I came to think that all the stories of my life perhaps had some type of meaning, at least for me. And my older sister, Sarah, seeing that I had sequentially exhausted all of Netflix while I was on bed rest, encouraged me to write down some of the stories that I had been recounting to the family over the years. So I did just that. I wrote a lot of stories down. And before I knew it, I had 2 pieces that were in the New York Times. And then from that came an offer to do a book. And from that came All That Moves Us, which was the book that I put out. Once that was out, I had the opportunity to go on book tour and also give various lectures across the United States. And that experience of going out and talking about these patients and what they have taught me over the years about hope and grief, about joy and disappointment, and about compassion and love was nothing short of transformative for me personally. See, my dad passed away of Lou Gehrig's disease. And so it happened when I was a resident, and I just buried myself in my work. And what I would often see over the years is I would see my patients, my dad and my patients, and I would see myself and their parents. And it was impossible to not get a connection. You know, you can't have a 6-year-old child at home as your daughter and be operating on a 6-year-old child that has an angle in her CPT, in her, you know, or cerebellar pontine angle, and not feel connected to those parents. It's impossible when you sit down afterwards. All the big brain surgeon, all that stuff goes away, and it just becomes 2 people sitting in the sleep room talking to the, or 3 people, me talking to the family about how things went, and them being grateful, and then me going home to my healthy child. It's impossible not to be connected to folks like that. So one of the kids that I used to talk about a lot is KJ. And he's a young boy. He was 2 at the time. He shot himself accidentally with a loaded gun that he found on the coffee table of his home he lived in with his mother, Diamond. To be clear, the weapon was not hers, but a guest in the home. The chapter on KJ is by far the most graphic of all of them. The title says it all, gunshot wound to the head. Now, getting permission from all the families for something like this was not only something I wanted to do, it was something that I had to do. A HIPAA violation allegation a few days after the book release would have been a very bad look. So when I approached Diamond, I told her the same thing that I told the other parents. Look, we can change the name, the gender, the age, we can pull the whole thing. It's y'all's story. But she wanted me to read it to her. Sitting in that room, she wanted me to read her that story, which, as you can imagine, was graphic. And as I would read it, as I read it, I would stop from time to time to check on her. She'd look up with tears streaming down her face and tell me to go on. Finally, when I was done, she told me something that I've never forgotten if I was traveled and given talks about the importance of storytelling. She said, Dr. J, you tell my baby story. You tell it for all the world to hear. KJ's story is ultimately one of hope. Here he is immediately after surgery. You can see the scar on the right side of his head where the bullet entered, and it actually blew out his skull and blew out a part of his skin and exited that's the left side of the screen, the right side of the patient. But here he is the last time I saw him in clinic. And here's one that Diamond sent me recently. And he still works with his weak hand, calls him Lefty. He says things like, come on, Lefty, you can do it. You got to grab that thing. He's a great kid, and I love seeing him whenever Diamond brings him into the PICU. It's really important that people who have had terrible injuries bring their children in so the pediatric intensive care unit nurses and the doctors there can see that, because it helps give them a sense of hope and importance of what they're doing. That when they see these sad things, they can now see the work that they've done and how that translates on the other end. And then right around the time of the book launch, Uvalde happened, where we learned that systems do not always work. And 19 children and 2 teachers were killed, and 17 others were injured by a single shooter with a semi-automatic weapon that he never should have had. At the time, I was an officer in our North American Society of Pediatric Neurosurgeons, the ASPN, and all of us were thrown into, I don't know what to call it except like this communal moral chaos. There was the emails that went around like, does anybody know a senator? Did somebody talk to a journalist? And then it was like, Jay, you got to write something. You got to write something, write something. And everybody was giving me examples of stuff to write. So I wrote something, and it came out in Time magazine. And it was cathartic to be able to get something out as a writer. It helped me take the storytelling aspect of it and tie it to the data aspect of it. And when I wrote that piece, what struck me the most were quotes from healthcare providers and, and both from the Newtown massacre, where 26 children died and adults, and Uvalde, and how they waited and waited and waited en masse in their respective EDs, all gowned up and ready, but either none or not as many as expected arrived. And that's because the majority of them were all dead at the scene, killed by deranged people with semi-automatic weapons they never should have had access to. Then, just over a year ago, 1 week ago, a year ago, I looked down at my phone to find a text telling me to go to the ED stat. And I just have to say, like, as the chief of the service, I'm like, who's telling me to go to the ED stat? I mean, I got residents and fellows, what are they talking about? And then it was quickly, a text was followed from our chief medical officer saying, Jay, there's an active shooter at the Covenant School, not 3 miles from here, and we need senior staff downstairs stat. This is not a drill. So there we were, 40 plus healthcare workers downstairs waiting, all gowned up, fully on our disaster protocol, waiting and waiting and waiting, and no one showed up. With each opening of the automatic ambulance blade door, we would surge forward, but it was never the victims. Everyone who had been shot died at the scene from massive chest injuries. It was devastating. We all wanted a chance to save those kids, to do something, but that chance never came. An acquaintance in the media business made the connection between my timepiece and me being in the emergency room at the time of that shooting. And so soon I found myself on various media sources like CNN and Morning Joe and MSNBC and others talking about the impact of firearm violence on children. And when I mean impact, I mean the data impact, but also the impact of what happens when a bullet that's high velocity and high magazine and low recoil, which means you can pump a lot of bullets into one target. What happens to a human body when that happens? And I have to tell you that initially I was excited about being able to be the expert, but it did grow stale as society fell back into its kind of regular rate and rhythm. This corresponded with me then coming into the role as actually president of our National Pediatric Neurosurgery Society. So with some substantial help from a friend who was one of those waiting after Sandy Hook, we started a firearm safety task force, and over the span of the year, we received just a bit of a master class on the epidemiology of firearm injuries. We met with advocates from the American Academy of Pediatrics, from the American College of Surgeons, and true first responders. We learned the stats behind the injuries, empowering ourselves with data, and we experienced the often Sisyphean task of turning both society's and our elected officials' minds. I think about Jon Snow not really holding that pump in the air. He had to go meet with probably 10 people. Probably had to meet with a lot of people to get that pump taken off. So I've certainly have lived the devastating stories with this, but my learning curve with the data was absolutely vertical. And we created this great website for our members to be able to advocate, and I did a few Rotary clubs, in the South, in Tennessee, just to try to feel like I was making an impact. But I didn't really feel like after a time that I was. Then a month or so after my term as ASB president ended, I met an amazing young woman in the middle, Kelsey Gastineau. She's a hospitalist at our children's hospital. She's a Hoosier through and through. And without a doubt, she's the most passionate and knowledgeable person that I know about this issue. I'm proud to say that I became her wingman. And all of that I've learned over the years, the epi degree, the writing, the master class, the stories, all came into play. She took me with her to meet with the Nashville mayor about how town and gown could team up, and soon called to ask me if I'd be willing to speak at the upcoming Tennessee Legislative Subcommittee. There was a bill to be put forth that would render any questions from medical providers to patients about gun ownership or gun safety illegal, subject to fine and state prosecution. So let me say that again. If I'm talking to you about your child, I would not be allowed to ask if you had a gun in the house, and I would not be able to talk to you about gun safety, about safe storage, about making sure the guns weren't left out loaded, about safety, about all those issues. That would be disallowed and we would be prosecuted. So there is a terrific TV show called The Pit, and I mentioned this last night at dinner. And I'm not going to play the scene, but the woman on the right is concerned about her son because she's found a list of girls that he wants to eliminate. So she took Ipecac in order to come in and get him to come in so that she could, and Ipecac causes vomiting, so that she could talk to the doctors about her son. One of the first things that the character did, Noah Wiley's character did, was sit down and ask if there were any weapons in the house. It wasn't in a judgmental way. It was absolutely in a way of caring and love. So Basically what happened is we made our way. It took us a couple of shots. They said they were going to do it at one time and they didn't, and then I showed up in a suit the next time and then they didn't do it then. But finally I decided to do it, and I left clinic in my scrubs, and I wanted to play the video if that's okay. So gentlemen, if we could play that video, that'd be great.
Thank you. You're recognized, Doctor.
So this is the Tennessee Senate.
Mr. Chairman, my name is Jay Wellons. I'm the Cal Turner Professor and Chief of Pediatric Neurosurgery at the Children's Hospital at Vanderbilt. I'm also the recent past president of the American Society of Pediatric Neurosurgeons. I'm a writer, and I'm also the son of a 2-star general who retired in the Air National Guard. For context, I grew up in rural South Mississippi and was formally trained in gun safety by the Boy Scouts of America. Dove and duck hunting with my dad's shotguns and target shooting with my rifle were a large part of my childhood and young adult life on my way to Eagle. I am a firm believer in the common ground narrative for America, in which we work together to protect both the right to bear arms and the right of healthcare providers to advocate to make firearm ownership as safe as possible. The unfortunate truth is that child suicide, accidental discharge, and intentional homicide constitute the vast majority of pediatric firearm injuries and deaths. In Tennessee, 1 in every 5 youth who dies from firearm injury. The state of Tennessee is number 3 in unintentional shootings, the most preventable cause, and there's been a 12% increase in firearm-related deaths in Tennessee. As a state, we're not doing very well, and this bill would make us do worse. I have heard the cries of the families who realize that their child is never coming home, gone from their lives forever. I've seen the damage to the brain and skull and spinal cord when a child takes a loaded gun from their mother's purse, points it at their sibling, and pulls the trigger. It's important to note that groups to include this, the Department of Veteran Affairs and the National Shooting Sports Foundation, the Firearm Industries Trade Association, strongly support safe storage. Similar legislation to this bill was initially passed in the state of Florida in 2011, the Firearm Owners Privacy Act, Docs versus Glocks. You may have heard of it. That law was ultimately deemed unconstitutional by the full 11th Circuit Court of Appeals with a 10-to-1 vote. You know why? Because it violated the First Amendment, a bedrock freedom that we have as Americans. In closing, it would be wrong to limit the ability of healthcare providers to provide this counseling. Firearm ownership is a right in our country, but it is also a responsibility. As leaders, we have the responsibility to identify areas where we can improve the health and safety for the people of Tennessee. Our children and their parents deserve the very best we can give them. Senate Bill 474 is far from that. Thank you, Mr. Chairman, and thank you to the rest of the committee.
Thank you. Thank you.
Thank you, Gus. Thank you. I appreciate y'all clapping. So that after our testimony, they pulled the bill from the House, they pulled the bill from the Senate, and I got a phone call from one of the legislators said that they feel like the writers of the bill bit off more than they could chew. So I felt that was a real victory. So I'm going to end up here and just say, my question when I speak to learners, whether it be our neurosurgery residents or the Vandy students in my narrative medical writing class, is what area in the public realm do they feel called to make a difference? I ask them to look deeply into their fields of choice and try to imagine it like a seed that they'll germinate and grow over time. There's a refreshing sense of no time to wait from this current generation of young doctors and healthcare professionals like Kelsey and like Hillary, who are the rightful inheritors of the mantles of Snow or Fenton or even Coop, where one feels compelled to step into the breach, to push against the norms, to build a clinic, to take on the legislative status quo. Sometimes it could be early in their careers and sometimes later. Dr. Coop had a lifetime contributing to the field of pediatric surgery, but did not become Surgeon General until the age of 65 when he began to have his greatest impact. I've seen some of my pediatric neurosurgery colleagues successfully advocate to have folate added to corn products to reduce spina bifida in the Hispanic population in Alabama. And our Vandy residents worked to ban the number of scooters on the roads of downtown Nashville. And an orthopedic trauma surgeon named Alex Jahanger, who successfully led Nashville's pandemic task force. It's just a few examples. So my challenge is to us all is to recognize that what Dr. Coop said years ago remains salient. Public health is vital to all of us, all of the time. All of the time, and not shy away from engaging in finding a broader healthcare area to impact, even if we feel like the issues are legion and overwhelming. As His Holiness the Dalai Lama said, if you think you're too small to make a difference, try sleeping with a mosquito. So thank you all for letting me be here. I'm very honored. This is my family, this is my dog, and these are the 3 books I'm reading. And I just want to do a shout out for Who is Government by Michael Lewis, because it is the book that is the perfect time for right now. So thank you all very much. It's been an honor to be here.
Thank you. That was amazing. As someone who's spent my career trying to do what you're doing better than I can do, we all thank you so much.
Thank you.
You know, it was in my medical career too, where it was, you know, I was trained as a pediatrician. It was ingestions and it was car accidents, and now it's guns.
Yeah, now it's guns. Yeah, thank you all. I appreciate it.
Yeah, thank you. Is there anyone who has a burning question that we could do before you step away? You can find him. Are you going to be at dinner?
Yes, I'll be at dinner. Yep, great. Thank you.
Yeah, thank you. Burning question from Larry Hunter.
Yes, Professor.
Maybe you can repeat it. I don't have a mic and I want the online.
Sure.
You know,
Here comes a mic.
So Coop, it's interesting to hear you talk about Coop as a hero, because I'm a little older than you, and I remember the AIDS crisis quite clearly. And from the perspective of AIDS advocates, Reagan in particular, but Coop also, were really slow
Yes.
To respond. And in fact, were actively destructive in at least the early stages.
Yes.
And so you've moved the Tennessee legislature. I'm going to just claim that Coop moved Reagan. What is the way to the heart of these folks who do not seem to share the same values that I think we do, in order to be able to affect the kind of change that he and you have done?
Well, I appreciate you saying that, and you're exactly right. And I think to get to the meat of your point, you know, I didn't sit up there and talk about that. My belief was that we should ban assault weapons, because that's my belief. I didn't get up there and talk about things that were very far over to one side. I wanted to establish myself in that situation as a person who grew up in the South, who went hunting with my dad, who taught my own kids how to, be responsible around weapons. We're not a big gun family anymore, but I wanted to establish the fact that I believe in this common American narrative. And that's kind of what that piece in Time magazine was about. And the title is, you know, if the politician could see what I see, we would have an answer to this question quicker. And it starts out with this very graphic description of what it's like to try to save a child in the OR with a gunshot wound through the head. And then I talk about how basically, if we just start with the idea that nobody wants their child shot at school, just start with that idea and get people around a table. I do believe that this extremism that we're experiencing right now is going to swing back into a place where we can sit around a table and get this work done. Now, that piece was written before this particular aspect of extremism that we've hit in our government right now. But I believe that to be able to sit down and establish this common American narrative where I respect your position, this is my position, we have to move something forward, so let's make that happen. But it did not come the first phone call was, we're going to talk about the bill, and we all got ready, and I moved patients out of clinic, and then they told us they weren't going to talk about it, and then they talked about it. So it got voted out of subcommittee up to committee. And then we all went, and I put my tie on and my suit, the whole thing, you know, and the pocket square, and I was there ready to talk at the next committee meeting, and they were going to talk about it, and then they didn't. And so then I had to go to one of them and to one of the heads and just say, look, I'm a doctor, I'm a neurosurgeon for children. I've moved a lot of patients out of my clinic to be here. I feel like that you all do not care what I have to say and are wasting my time. And as an elected member of our legislature, I want to know, please tell me why that is not the case. And to his credit, he was like, I didn't even think about the fact that you had to move patients. I didn't even think about that. He was chagrined. He was like, it's my first time being it. And literally that right there, I just the next day, I wasn't going to go. It was like Lucy and the football and Charlie Brown. Not going, I've done it, I'm not done. And then I just went. I just got in an Uber and went and made it, I bet, 15 seconds before I sat down in my scrub, as you saw me. And then that knocked it out of the Senate. And then that same person who I mentioned a minute ago, he called me to say, hey, we all met as a caucus and that's going to get knocked out of we're going to drop it out of the House, and we wanted you to know that because of what you did. So I just think it's just like respecting other people's position, but also saying that, you know, I have some creds here and I want to answer and fix this problem. That's where I think it comes from. That's a lot of words, but that's kind of what I think. Yeah. Okay.
Thank you.
All right.